Ronnie, my name is Hank. I'm a student physical therapist working underneath Dr. Clausen. So we're seeing you in today for right lateral ankle pain, correct?
That's correct. Yeah.
Okay. So we're going to try to use some non-thermal ultrasound today to help kind of kickstart your treatment process and kind of kickstart that healing, get us going down the road towards recovery for it. So it's going to do that. The non-thermal ultrasound will do that by creating cavitation around the tissues, and then that's going to allow for microstreaming. So we're going to get fluids around those tissues on his ankle. It's going to kind of help kickstart that healing process. Yes. So the indications for this would be that he has painful swelling and some bruising. So we'll check that out with the integumentary screen that we're going to do as part of getting him set up. And then the contraindications for him would be his pacemaker, but because we're down on his ankle, we're not going to worry about that, and his type 2 diabetes. So when we're doing the skin check for his other injury-related symptoms, we'll pay special attention to the sensory screening. So if it's okay with you, that we do the ultrasound treatment on you today?
We're good.
All right. So I'm just going to have you lay on your back. Yep. And then onto your left side, if you don't mind. Okay. All right. So okay if I roll your leg up a little bit?
Yeah, I can roll the leg up.
All right. So we'll check out his skin over here. We would see some redness, some swelling, some bruising, and then can I have you look the other way? Do you feel this?
Yeah.
Understand? Okay, good. So then we know he has sensation, so we're good to go. So we'll set up the parameters on the machine here. All right, so for this non-continuous thermal ultrasound treatment, we'll start by getting the machine set for ultrasound. I'm gonna go to 3 megahertz just because that won't go as deep into the tissue, and because we're treating on the lateral ankle, you don't need that depth for the tissues. So then I'm going to go with my duty cycle. We're going to go to 20% because we want it to be non-thermal, and that's not going to allow like the heating, but it's going to allow for the non-thermal healing benefits that we're going for. And then for my intensity, we're going to go up to 0.5 for today's treatment. We're going to start with 5 minutes. You could go up to 10, but because it's his first time, we'll start lighter. All right, so then we will take ultrasound head and we will get some of this gel on there. Let's see, that should be enough. And then we will prep our treatment area. We want to make sure that the treatment area is covered well and that we have the entire head covered. All right, before we turn this machine on. All right, can you cut it? All right, so we're gonna start the machine with the contact here. All right, then we're just gonna keep it moving, keep her moving over the area. And we're going to want to go about 2 to 3 times the ERA, the effective radiating area. So you don't want to stay in one spot too long and risk burning any of his tissues. All right, so, and it's been coming up on 30 seconds here, and we will, end there for today. All right, then you can, once the machine is off, you can take this off of them and we'll get that cleaned later. All right, and then we'll check Ronnie's skin on the treatment area, get him wiped off. So, any pain with that, Ronnie?
No.
All right, his skin is looking good. I mean, nothing that looks like it came from the ultrasound. All righty. Any questions about today's treatment before we wrap up?
When can we do this again?
We can do this again soon. All right. We'll see you, Ronnie. All Bonnie, my name is Hank. I'm a student physical therapist working with Dr. Clausen today. So you're in for the pain on your lower back on the right side. All right. So we are going to use ultrasound today to try to help alleviate some of those painful symptoms, work on some of the tissue in there, all that. So Bonnie, because it's been over 2 years that she's had this pain, she would be considered in the chronic phase. So we'd be using this thermal ultrasound treatment to kind of, for the pain relief benefits, and then maybe to try to stimulate blood flow to that area, help a little bit with that. So the indications for this would be the fact that you have pain, you have chronic pain. We use the thermal to try to alleviate some of those painful symptoms. But you're not in that acute phase of pain, which would be a contraindication for this thermal type of treatment. So, and let's see, from looking at your chart, you don't have any contraindications. The only thing I could think of that might be something for you, are you pregnant at all?
Not that I know of.
Okay, sounds good. So from what I've told you already, are you comfortable with doing the ultrasound treatment?
I think so.
Okay. So to treat this area, I'll need you on your stomach, and we'll have to lift your shirt up a little bit to expose the area. Is that okay with you today?
Yeah, I can do that.
Alright, perfect. So yeah. So is your pain like kind of this area?
Yeah, right about there. Yeah, ow, yeah.
Okay,
Yeah.
sounds good. Alright, so we'll set the machine up for thermal ultrasound. So first we'll get it set up for ultrasound. I'm going to use 1 megahertz because it's going to be a frequency that's going to allow for accessing those deeper tissues, kind of less than, but right up around 5 centimeters. We're going to go with continuous because we want it to, always be going so we get those thermal benefits. That's what we're looking for with this treatment. I'll keep it at 5 minutes for the timing because it's her first time in, and we'll test her for her tolerance. I'm going to put this up to 1.5. And for this thermal type of treatment, you can go 1.5, to 2 for your intensity level. But we'll start off with 1.5 since it's her first time with this, just to kind of gauge her reaction and response to it. All right. So we'll take this ultrasound head, put the gel on. Alrighty. And then we'll prep our treatment area before we turn the machine on. So this was where your pain was, right?
Yeah.
Okay. So we'll get this area covered, and we want to make sure that the ultrasound head is covered so we get that proper amount of treatment potential. And then we're going to turn our machine on, and we'll just keep this head moving. And we want to go for about, 2 to 3 times our effective radiating area for this treatment. Want to make sure that we keep the head moving so that we don't burn her. And does it feel too warm for you, Bonnie?
That's just right.
Everything feel okay with this? All right. You just let me know if it gets uncomfortable at all, or if it gets too hot. All right?
Alrighty.
All right. We've been doing this for about 30 seconds, so we'll cut the tree. We'll keep this on her, and we will stop the machine. All right. Sounds good. So we'll clean this off later. We'll get Bonnie attended to. So we'll check her skin. And her skin looks healthy still, which is good because that's how we started. All right. Any questions before we wrap up treatment today?
When can we do this again?
Yeah, our next appointment.
Okay.
Thanks.